Hi, I'm Liz Wilkinson. I run the high volume cataract unit at Exeter at the Centre of Excellence for Eyes, which is in our old Nightingale COVID hospital. We use a Surgicube mostly because it's an old home base and we just didn't have the ceiling height to put in a new theatre. Plus we really didn't have the funds. So what we've done is we put in the Surgicube Clean Air into a procedure room, and we have now reached about 2,000 cataracts in the Surgicube with a see and treat pathway, which I think is the thing that people are most interested in. We're moving that see and treat pathway now to a bilateral pathway, and what that means for patients is they have one visit to the hospital and both their cataracts are done. And that's a brilliant thing for patients, especially when you're dealing with quite a large area, which Devon is, and it's quite rural, so they come a long way. And the see and treat pathway is about having a telephone call beforehand so that we can make sure that you're suitable for our high volume unit and you want to have cataract surgery. And we're upstreaming all of that information so that we're gathering all the information and patients are making their decisions as soon as possible after they're referred, so that their consent process really goes all the way to the point where they're seen on the day. And so that means that we have very few patients that don't actually go to have surgery. And we can do quite a lot. We do up to 12 in a list, and the Surgicube has a turnaround time where we change the drape. So we're doing above girth average on a really fast bilateral list. You might ask what the complication rates are. Well, fingers crossed, touching some wood that's all Formica. The complication rates are I think, world leading. Essentially, we have zero, and our posterior capsular rates are incredibly low and really only amongst trainees or induction lists for new consultants. So it's very safe, it's very quick. Patients really love it once they're introduced to it, and we couldn't do our operating without it.